We are live, sir.
Thank you. Hello, I'm Dr. Nilesh Balkawade, Clinical Head at Oasis Fertility Pune. I welcome you again to another session of FB Live. Today, we are going to talk about poor egg quality, which is a major concern as the age advances. And many patients who undergo ART treatments like IUI, IVF are often told about poor egg quality. So we are going to learn about it. So basically what this egg quality means and how we can improve this egg quality. We are going to see what are the causes of poor egg quality. The first and the foremost cause is age. Age of the woman is very important criteria to define the egg quality. It has been now extensively studied, extensively researched that the egg quality drops with the advancing age, as does the egg number. So the quantity and quality of eggs both is hampered as the age of woman advances. The reproductive age group of woman is somewhere between 15 to 45 years when she menstruates. But the egg number and the egg quality starts to drop when the woman reaches the age of 30. And this significantly drops after the age of 35. 35 is taken as a benchmark age where pregnancy should be tried before the age of 35, because after the age of 35 the pregnancy by a natural try and by other techniques of ART, the success rate significantly goes down. So the age of marriage and the age of childbearing both are very, very important when we talk about egg number and the egg quality. Second important cause of poor egg quality can be hormonal imbalances such as the polycystic ovarian syndrome, where excessive insulin and androgen environment inside the ovaries, the hyperinsulinemia and the hyperandrogenemia can cause a poor egg quality, and this can impact the success rate of pregnancy or fertility in such patients by either methods of IUI or IVF. So this is one important cause. We are going to learn about how to decrease it. So we have to think about treatment of these patients of hormonal imbalance as well. Third important cause is poor ovarian reserve. This is definitely linked to the age, but this can be premature ovarian insufficiency as well, where the egg count tends to drop before the age of 35 or 30. The egg count, and there is complete ovarian insufficiency. If it occurs, we call it as premature ovarian failure. So this is important cause. Fourth important cause can be hormones, hormonal imbalances, as we have seen in PCOD. Other hormonal imbalances such as raised levels of prolactin can sometimes cause the follicle not to rupture, or the ovulation can be hampered in such cases, where the follicle can go into luteinized unruptured follicle, and this can be a problem regarding the egg number and the egg quality. Another important cause can be hormonal imbalances related to the thyroid gland, hypo and hyperthyroidism. Lifestyle related factors are again very, very important, and one of the most important cause is addictions, and tobacco addiction in either form of chewing tobacco or smoking of tobacco can be harmful and injurious to health and the egg quality as well. Diet which are which have a high content of oxidants, and that is fried food, etc., and also diet which are high in saturated fatty acids can lead to problems with fertility and egg quality. Lack of exercise can again lead to hormonal imbalances, and poor hormones and the environment in the ovaries really leading to a poor egg quality. We are first going to talk about age-related decline in the ovarian reserve and the egg quality. So the AMH and the antral follicle count and the FSH will give you the clue whether the ovarian ovaries are failing. So the AMH and antral follicle count are definitely guide us regarding the egg number, but it is not much related to the egg quality. The egg quality may be sometimes independent of it, and the most important significant factor is age as opposed to antral follicle count or AMH. So only female age and number of oocytes can predict the lower birth rate in a patient of IVF. So if the female age is increasing and the number of oocytes which are retrieved is decreasing, the success rate of IVF will definitely drop. So these are two important factors which have a poor oocyte quality. Now we see there is a classification of defining this woman who have poor oocyte quality because of their lower egg reserve or the oocyte yield, which was poor. One is young woman with a good reserve, but they couldn't yield that many number of follicles, so unexpected poor response during IVF. Older woman with unexpected poor response. Group 3 is a younger woman with low ovarian reserve with expected poor response, and group 4 is an older woman that is more than or equal to 35 with poor oocytes and poor response. So out of this, group 4 has got the worst prognosis with regards to the success of IVF. So this is regarding the prognosis. So the failure rate of IVF increases with group 4 and group 2 rather than group 1 and group 3. The older the woman, the lower the probability of getting euploid embryo. So what is euploid? Genetically normal number of chromosomes in the embryo means euploid embryo. So as the age advances, the oocytes uh, get older, and this leads to a poor oocyte quality, and this poor oocyte quality can lead to formation of aneuploid embryos, which is irregular or extra or less number of chromosomes than the expected number of chromosomes. So euploid number is the number of chromosomes which are needed for a good pregnancy to occur. So whenever there are euploid embryos, the success rate of artificial reproductive techniques increases. The transfer of euploid embryos maximizes the IVF efficiency by eliminating the age-related decline in the implantation. So even if the age is more, but if we get a euploid embryo, the success rate of IVF or ARD techniques increases. So friends, here I want to tell that the quality of sperms can be assessed in vitro, that is outside the body, but the quality of eggs cannot be assessed by routine investigations uh, in any form. It is only during IVF or when we remove eggs outside the body, we can assess the egg quality in the form of mature eggs, M2 eggs, M1 eggs, or GV eggs. These three types can tell us what are the number of eggs there. And even if we get the M2 eggs, the embryo finally, which results, can give us the true quality of the eggs and the true quality of embryo. Once the embryo is formed, this can be genetically assessed to see whether it is a euploid embryo. If we get a euploid embryo, the success rate remains the same as for a younger age group. So what we can do to improve egg quality in poor ovarian reserve patients? Clinically. There are GnRH analog regimens. The dose of gonadotropin injections is also important. What trigger we are planning, what adjuvant therapy, what medicines we are giving, what are the dual protocols, what are the accurate protocols. These all help to improve the success rate in patients of poor egg quality and poor ovarian reserve. Personalized use of laboratory technology and personalized luteal phase support also helps to improve the egg quality. So these are the patients group 3 and group 4 which mind us a lot, and therefore different types of protocols can be designed on an individualized basis. So individualized case selection and individualized protocol for these patients would help to improve the egg quality in IVF patients. Along with the GnRH antagonist, if you are giving, we can give a pre-treatment with the estrogen or the OC pill, or stimulation with recombinant FSH, adding recombinant LH, especially if the age is more than 35, with or without androgens as supportive treatment can again be thought of. A fresh transfer or a oocyte or embryo accumulation and then FET can be planned. The number of eggs which are required in age less than 35 to prepare one euploid embryo is 4 to 7. but in older age group, number of eggs required is at least 12. So this is very high. So therefore, the success rate drops. So now, what are the steps to improve egg quality? Before that, we'll just have a word regarding how to improve egg quality in PCOS patients. So where PCOS has been known is the case of hyperinsulinemia and hyperandrogenemia. Therefore, to decrease the insulin levels and androgen levels, the most significant thing will be the dietary changes and exercise changes. So diet which are high in the simple carbohydrates, which have a high glycemic index, should be avoided. So sweets, foods with maida, then fried foods, all these food stuff should be avoided. Diet which is rich in proteins and antioxidants, like fresh fruits, salads, lots of water should be taken in a priority. So this is the dietary changes. Exercise, cardiorespiratory exercise of around 30 to 45 minutes is a must in a case of PCOD, especially she's obese or PCOD. Exercise has also shown to improve the success rate in lean PCOS. So this is going to improve the ovarian environment where the eggs are growing, and that's why these measures are very very important when it comes to improving egg quality in a PCOS female. Now we'll come to how to improve egg quality in general in women if they are suffering from poor egg quality, or if they had a previous IVF cycle which was failed because of poor egg quality. How to prevent a fall in the egg quality? The first and foremost important thing which is highlighted is don't let your fertility go up in smoke. The smoking and the chewing of tobacco is very very harmful for your fertility, for males and females both. But in females, we are talking of the egg quality drops down tremendously, the egg number drops down tremendously. As the number drops, the quality also drops. So quit smoking, quit chewing tobacco if it's practiced. Even if you're not smoking and your partner is smoking, a passive smoking has also a deadly impact on the egg quality. So this is the first and foremost thing, is to quit addictions in the form of smoking, drugs, or alcohol. Second important thing in this era of the 21st century is learn to manage your stress. More stress levels will give you a changed environment of your body, changed hormones in your body, and this is going to significantly affect your fertility. This is also going to affect your egg quality. So learn stress management techniques is very very important. Invest in a healthy diet. Friends, we are taking help of this fast food. We are uh, not going to our age old Indian diets. Actually, we should have been following these diets which were very good for us. The age old fast foods in the form of fresh fruits, nuts, or salads were very very important. So I think we should invest in a healthy diet rather than investing in a gym protocol or in a dietary protocol. Stick to a healthy diet is very very important. Opt for a normal body mass index. This is very very important to improve the quality. Normal body mass index, the proportion of height and weight of a patient, should be between 18 to 23 for the Asians. Anything body mass index more than 23 to 28 will be considered as overweight, and anything body mass index more than 28 will be considered as obese. So opt for a normal BMI. Try to reduce weight whenever you're fighting fertility issues. Ensure that you have a good blood flow, and this can be ensured by taking lots of water, having a good exercise regimen. There are some exercises which are there for fertility as well. So fertility yoga is now coming up, and fertility cardiorespiratory exercises are also very very important whenever you are considering fertility. So take a help of your fertility specialist, ask them, and they'll be helping you. Have your essential supplements. So along with the diet, some essential supplements are very very important whenever it comes to improving egg quality. We are going to talk about these essential supplements, but never learn about these essential supplements from the internet. Take a proper fertility advice and then only start taking any essential supplements. Regarding egg quality, the last and the most important thing is freeze your future. So if your egg quality is dropping, if you are thinking about childbearing some in a later stage of life, if you're not willing for going for childbearing and the egg quality is very low, Think of freezing your eggs. These options are easily available nowadays. Egg freezing, egg social freezing are coming up. If you're married, think about freezing your embryos if you don't want to have a child immediately. Friends, dietary supplements are very very important, and this along with the new this can be a form of nutrition as well, but they have some medicinal value. These are called as nutraceuticals, and medicines to improve this quality can be labeled as these nutraceuticals. Out of them, one of them very important is the DHEA, dihydroepiandrosterone sulfate, where this DHEA is a form of androgen or male hormone, which male hormone precursor, which when used in adequate amounts can improve the ovarian environment and lead to a better egg quality than otherwise. So this egg quality improvement strategy, lots of work has been done by Professor Norbert Glacier, and I was fortunate enough to meet him during the inauguration of my book. And DHA is a molecule which has been extensively researched, and DHA treatment for around 2 to 3 months can be helpful in improving the quality to an extent. But of course, you have to take medical advice before you start taking this. Coenzyme Q10 is a molecule which is now available in medicines. This can be taken from natural foodstuffs as well. So the five foods which are incredibly rich in coenzyme Q10 are the soybean, broccoli, peanuts, fatty fish, and citrus fruits such as oranges. So these are foods which are rich in coenzyme Q10 and other antioxidants. So this can be definitely be used as an adjuvant along with the medicinal coenzyme Q10. Inositols have also shown to improve the egg quality, and these are also considered as food supplements. So they can be taken in a tablet form or inositols from the natural fruits such as oranges, melons, green leafy vegetables, brown rice, liver can be helpful in giving you inositol supplementation, and this can help to improve the egg quality. Hormone stabilizers can be used as medicinal agents along with these agents. So these, of course, have to be taken with the under doctor's supervision. So, friends, this is regarding what we can do to improve equality. One more important thing at the last remark is age of marriage. Friends, in 1970, the age of marriage, which we can see, was very low, and the woman who used to get married before the age of 20, and the childbearing used to happen immediately. So the fertility problems were less. Regarding the maturity of a woman and age of marriage in a woman, the government has taken all the factors into consideration, and it was decided to allow a woman to marry after the age of 18 so that she completes her bone maturity. Regarding the fertility, a woman should get married and have her childbearing preferably before the age of 30 or 32, which is the best period for a woman to conceive, according to the recent guidelines. We can wait for fertility up to age of 35 also, but after the age of 35, the reproductive potential is going to go drastically down. The chances of natural pregnancy, natural conception are going to go down. So age of marriage is again a very, very important criteria when we are talking about improving oocyte quality and having a good oocyte quality during the childbearing period. So this was regarding improving the oocyte quality. Thank you for your patient hearing. And if you have any queries related to improving egg quality or how to have a good success rate of IVF in patients with low egg reserve, do contact us, do connect to Oasis Fertility. Oasis Fertility Pune has its two branches. It is placed at Dynasty Commercial, Wakad, and the second branch is at Arisa Avenue in Kharadi, near the World Trade Center. So you can contact us at any of these centers. If you have any query regarding poor ovarian reserve, please do connect to us on the number given below. We would be happy to answer it. Till now, for then, I wish you, I will bid you bye. But before that, if you like this video, please do share with your near ones who would get help from this video. Do like it and share it if you have liked this video. Thank you so much for your patient hearing. I hope there are no questions for today. If you have any questions, you can post in the chat box, which will be answered subsequently. Thank you.